Black Men and Women, the Inventor of Medical Science. My parent taught me to give credit where credit is due. Somehow American has always forget to give black men and women their credit, in the field of medical science. The Edwin Smith Papyrus is an ancient Egyptian medical text, named after Edwin Smith, who bought it in 1862, and the oldest known surgical treatise on trauma. It was known to ancient surgeons as the secret book of the physician. This document, which may have been a manual of military surgery, describes 48 cases of injuries, fractures, wounds, dislocations and tumors. 4. It dates to dynasties 16 to 17 of the Second Intermediate Period in ancient Egypt, c. 1600 BCE. The 16th dynasty, c. 1650 to 1580 BC, ruled the Theban region in Upper Egypt. Of the two chief versions of Manetho's Egyptaica, the 16th dynasty is described by the more reliable Africanus, supported by Sincellus, as Shepherd, Hyksos, Kings, but by Eusebius as Theban. The papyrus is unique among the four principal medical papyri in existence, 6, that survive today. While other papyri, such as the Ebers Papyrus and London Medical Papyrus, are medical texts based in magic, the Edwin Smith Papyrus presents a rational and scientific approach to medicine in ancient Egypt, 758, in which medicine and magic do not conflict. Magic would be more prevalent had the cases of illness been mysterious, such as internal disease. The Edwin Smith Papyrus is a scroll 4.68 meters or 15.3 feet in length. The recto, front side, has 377 lines in 17 columns, while the verso, back side, has 92 lines in 5 columns. Hieroglyph designating the brain or skull. Among the treatments are closing wounds with sutures, for wounds of the lip, throat, and shoulder, 13, bandaging, splints, poultices, 9, preventing and curing infection with honey, and stopping bleeding with raw meat. 5. 72 Immobilization is advised for head and spinal cord injuries, as well as other lower body fractures. The papyrus also describes realistic anatomical, physiological and pathological observations. 12. It contains the first known descriptions of the cranial structures, the meninges, the external surface of the brain, the cerebrospinal fluid, and the intracranial pulsations. 2. 1. The procedures of this papyrus demonstrate an Egyptian level of knowledge of medicines that surpassed that of Hippocrates, who lived 1,000 years later. 7. 59 And the documented rationale for diagnosis and treatment of spinal injuries can still be regarded as the state-of-the-art reasoning for modern clinical practice. 14. The influence of brain injuries on parts of the body is recognized, such as paralysis. The relationship between the location of a cranial injury and the side of the body affected is also recorded, while crushing injuries of vertebrae were noted to impair motor and sensory functions. 12. Due to its practical nature and the types of trauma investigated, it is believed that the papyrus served as a textbook for the trauma that resulted from military battles. The Edwin Smith Papyrus dates to dynasties 16 to 17 of the Second Intermediate Period. Egypt was ruled from Thebes during this time, and the papyrus is likely to have originated from there. 5. 70 to 71 Edwin Smith, an American Egyptologist, 6, was born in Connecticut in 1822, the same year Egyptian hieroglyphic writing was decoded. 2. Smith purchased it in Luxor, Egypt in 1862, from an Egyptian dealer named Mustafa Aga. 10. 25. The breasted edition, 1930, left page photograph of the original papyrus, right page transcription of hieroglyphics. This is plate 13, column 13, case 38 to 41. The papyrus was in the possession of Smith until his death, when his daughter donated the papyrus to New York Historical Society. There its importance was recognized by Caroline Ransom Williams, who wrote to James Henry Breasted in 1920 about the medical papyrus of the Smith collection in hopes that he could work on it. 1516, he completed the first translation of the papyrus in 1930, with the medical advice of Dr. Arno B. Luckhart. 10. 26 Breasted's translation changed the understanding of the history of medicine. It demonstrates that Egyptian medical care was not limited to the magical modes of healing demonstrated in other Egyptian medical sources. Rational, scientific practices were used, constructed through observation and examination. 11. 12. From 1938 through 1948, the papyrus was at the Brooklyn Museum. In 1948, the New York Historical Society and the Brooklyn Museum presented the papyrus to the New York Academy of Medicine, where it remains today. 5. 70. From 2005 through 2006, the Edwin Smith Papyrus was on exhibition at the Metropolitan Museum of Art in New York. James P. Allen, curator of Egyptian art at the museum, published a new translation of the work, coincident with the exhibition. 5. This was the first complete English translation since Breastides in 1930. This translation offers a more modern understanding of hieratic and medicine.